You are listening to The Scope, a podcast dedicated to having open conversations about topics relevant to our patients and community. Today, we're talking about careers in healthcare. Let's get started. Hi, everybody. Today, our guest is Heather Witt, an HR business partner at Phelps Health. Welcome to our show, Heather.
Thanks for having me.
Yeah, we're so stoked to have you here. I love talking about learning and education, and I feel like this is a perfect fit because you've done so many amazing things at Phelps Health.
Thank you.
You're welcome. So we love starting off our show, just getting to know a little bit about you, your role at Phelps Health. So let's just dive in. You've been here for a few years.
Yes, I've been with Phelps Health for about 16 years.
Mm-hmm. That's amazing. So what kind of has kept you here at Phelps Health? What makes you so passionate about working for this organization?
So I joined Phelps originally for a culture fit. I wanted a larger but small town feel organization, one that represented our community well, but also spoke for the health and wellness of people in our community. And I think Phelps Health does that in an outstanding way.
I love that. That's fantastic. And you've also worked in lots of different departments over your last 16 years because you're a lifelong learner. Let's talk a little bit about that.
Yes. So my background, my undergraduate degree is actually in social work. Mm-hmm. And I started out as a care manager, and my first unit was the OB and nursery unit. So I had come from working with families and children in our community. I expanded on that experience here as well as our skilled nursing facility. So working with that vulnerable population after an illness, recovering, getting ready to go home, transitioning back to their home environment. And I just really learned to love that. I learned a lot of clinical knowledge because I did not come to Phelps with that. Mm-hmm. My leaders encouraged my learning. At one time, I considered going back to nursing school, so I took some classes, learned that nursing was not for me, but I learned a lot from anatomy and physiology classes as well as nutrition classes, and that just expanded on my love for health and wellness and assisting others to have that in their lives.
That's amazing. So tell us a little bit about yourself outside of Phelps Health. So what are a couple of things that you're interested in? Because you love this community, like you mentioned. Mm-hmm. You wanted a big town feel that was really kind of in a small town, right? That's pretty unusual.
Absolutely. So I actually grew up in the great state of Pennsylvania, and I came from a larger community. It took me a little while to get adjusted to this area when my family uprooted and moved here at the bright age of 21. So that was a little bit of an adjustment, but I learned within a few years that I loved the Midwest. I loved the outdoors. I met my husband here, and we have a family of 3. We have 2 older boys that now are adults and live out of the area, and we have a 12-year-old. We live in our local community of St. James. My passions include health and wellness even on the outside. So I love fitness. I like anything cardio and strength training, and I actually teach group fitness outside of my time at Phelps.
That is fun. Where do you do that at?
So I
need to know personally.
Okay. I actually do a faith-based fitness program, and so I teach right now currently at my church on Saturdays.
That's amazing. How cool. Okay, well, we need to connect over that once we're done with the podcast today. So what has your career journey been like at Phelps Health, and maybe even before you were at Phelps Health? And tell me a little bit more about how you chose the field that you're currently working in, because you're not in any of those care management type roles now. You're in human resources.
Absolutely. So my overall approach to my education as I was younger is I knew I just wanted to help people, right? So that's kind of hard to pinpoint because there are so many great fields where you can help others and serve others, and that was my goal. So while I started serving children and family in our community, as I grew into my role at Phelps Health, I loved being able to train others, being able to teach others, and really connecting with families. But then that soon became a passion to connecting with my coworkers and investing in their growth, helping them, connecting with them and serving them. And so I knew that I needed to go back to school to further my education. I just wasn't sure on what aspects. It took me a little bit to dwindle that down, but I eventually chose a master's degree in organizational leadership, which is sort of like an MBA, but with a more HR approach. So you get into that human growth and development.
Oh, I love that. So you and I are very similar. My master's was in organizational leadership and an emphasis in digital marketing. So
awesome.
people skills, but then also marketing, because obviously I'm passionate about that, right? Otherwise I wouldn't be sitting here talking to you.
Yes.
Very cool. What kind of inspired you to pursue more education? Because there's more that you're doing even right now.
People have always come to me and said, I think you're a natural born leader.
Yes.
It took me a little bit longer to get there in that belief. But when I did, I realized I needed to grow with that at higher educational level. And so getting that higher education, sometimes there were barriers to that. One, obviously knowing what I wanted to focus on, but other two is the financial aspect. And staying with Phelps really allowed me the freedom to get rid of that financial barrier because of our tuition reimbursement and other great benefits.
So you were able to cover the cost of your tuition through Phelps Health?
Absolutely, nearly 100%. The other portion, I applied for a scholarship through my university, and I was granted that scholarship. And so all of my fees were covered minus my books. My family just picked up the cost of my books.
That's amazing. What a good family.
I know. Very supportive.
Yes.
So in both aspects, the organizational family and the home front.
Yeah, I love that you kind of marry the two of them. Very cool. So how has Phelps Health continued to help support your education in your new role?
Sure. So in my new role, being new to HR, I still have a lot to learn. And so they are already promoting mentorship within my department with a senior leader, as well as continuing that financial aspect and supporting me to get a certification in that field of HR. And I will test for that later this spring.
That's exciting. Well, all of us have our fingers crossed for you.
Thank you.
We know that you'll succeed and be amazing at whatever you do. So the healthcare landscape really has changed dramatically over the last couple of years due to COVID and lots of other changes that happen in healthcare. What's one change that has really impacted how you work?
So I was thinking about this change and as a social worker, as an HR, you really are an advocate. And I think the amount of change and the pace of change in the world in general has changed how I work. It has raised my level of self-assessment and how I can approach change, but also how I can lead others to change. Pivot was probably the most overused word of 2020 other than COVID, right? So learning how to be flexible and agile during that time and lead others to do the same really changed the way I work. So not just doing the actual work functions, but approaching others and growing into that upper level of leadership and having good mentors really changed the way.
I love that. That's a perfect segue into my next question. What's rewarding about and challenging about working in this field?
So one of the most challenging things is not coming from that clinical background. Sure, I have social work degree, but not having that nursing knowledge, physician knowledge, clinical, natural health and science can be a little bit challenging. One of the ways I battled that was obviously pursuing education, going back, taking some random classes such as A&P and nutrition, but also relying on my colleagues and physicians. And then we have other resources like peer researched articles, reviews. The financial support of the admin to help your growth is just one of the benefits here at Phelps to overcoming any knowledge gaps you may have or growth that you may desire.
That's fantastic. I love hearing that, and all of the different departments and resources that you used to get to the point to where you are now, where you can go in a clinical setting and you can have a conversation and feel not only comfortable, but really confident having that conversation.
Absolutely. I feel completely competent and able to speak to my knowledge.
So what's something that you wish maybe somebody would have shared with you as you began your journey, a few years ago?
Absolutely. One thing I would definitely share is that we tend to say all the time that we're just in a season, right? But to get through a season, you have to grow through that and grow out of it. And so I would say taking accountability for your growth is of utmost importance, and not just putting that on someone else, but really owning your passion for growth, where you want to be, and your goals is of utmost importance to get you where you want to go.
Whenever you say accountability, what does that look like for somebody, or does that look different for everybody? Because you mentioned seasons of change, and that's something in my friend group that we often refer to as well. Since seasons of change, sometimes you're in a summer or a winter where you're growing, or maybe things are dying out so that new opportunities can arise.
Right.
How can somebody be prepared for those types of seasons that might be really, really challenging?
Sure. So I think keeping your mind sharp, keeping your health well, obviously is a good foundation to get you through seasons. But I also think connecting with others, collaborating with others, knowing that seasons do look different for everyone. Okay, so while some people have the resources, some people have scarce resources. Understanding that, being able and not afraid to ask for help when you need it, and understanding that here at this organization, we operate as a family, and not being afraid to ask and open that door. Those are the sort of things that help you accelerate that change to get through that season.
I love that. I love that you mentioned again that we're a family here. We have an open door policy. I would feel comfortable coming into your office and saying, Heather, I'm struggling with this. I need help.
I would gladly help you. Yes, I love that.
Are there any new skills that you've developed during your time at Phelps Health? I know you've already kind of mentioned a bunch of them. You've grown so much during your time here, but Let's just dive into that a little bit deeper.
Sure. First, I want to say communication. I went from a timid girl to someone who is more assertive with their communication and able to express themselves well, whether that is in a boardroom, or whether that is to a physician or just to my colleague next door. I think communication is extremely important, and that has been my number one skill that has grown. Also emotional intelligence, just being able to understand and have empathy for my colleagues, my coworkers, as well as, it's not just about the patients here, it is about our family within the walls. We are about our people. So being able to understand and sit with others has also been very important. Those are the two main ones, I would say.
Yeah, I think both of those are so important. I love that you mentioned communication because obviously I'm a marketer. I really value communication. It's something that we have to do every day just because of the nature of our job. But regardless of the industry, being able to connect with those around you and being able to share information in a way that's clear and concise and really gets your point across is so invaluable.
Absolutely.
It's almost like learning how to write.
Yes.
It's a life skill.
It is.
Yeah, absolutely. So just kind of to wrap up, what advice would you give to others who are considering going back to school? I know you're going to say go for it, but let's talk more about that.
Sure. When I say go for it, I would say do not be afraid. Do not be afraid to take steps. Fear is the enemy, right? You have to learn to take risks. That was something that was difficult for me. You have to be willing to reach out to your leader, to your upper line, someone that is approachable to you and saying, this is my desire. I need help and guidance on how to get there. The other thing I would say is open the doors and explore with curiosity really what you want to do and where you want to be in the end. At the end of the road. There are a lot of degrees, there are a lot of programs, there are a lot of opportunities here at Phelps and within our community to serve others and to grow your knowledge. So don't be afraid to ask for opportunities to explore. We've had people come in and kind of shadow and different things at different times. All of those opportunities are welcome here at Phelps.
I love that. I love hearing that. I already have things written that we need to talk through after this podcast. Heather, thank you so much for being here today. You are a wealth of knowledge. Our organization is so lucky and so grateful to have somebody like you who's so passionate about the people that they work with.
Yeah, thank you.
Thanks so much for tuning into The Scope. If you missed this show and would like to learn more, check out phelpshealth.org.